Good afternoon. I'm Steve Starovic, President and CEO of Achieva. First order of business is I'd like to extend a very warm welcome to Governor Shapiro. Welcome. And before I share some brief remarks, I'd like to acknowledge a few folks who are present today. A few of our local elected officials in the Pennsylvania General Assembly are here. State Senator Jay Costa, State Representative Arian Abney, and State Representative Jessica Benham. We very much appreciate their support and their attendance today. From the PA Department of Human Services, I'd like to acknowledge Dr. Greg Chirpus, Medical Director for the Office of Developmental Programs, and Michelle O'Toole, ODP's Western Regional Program Manager. And from Achieva, I'd like to acknowledge Lisa Raza, our Communications Director, Mary Hartley, President of Achieva's affiliate, the ARC of Greater Pittsburgh, and Shane Ruse, President of Achieva Support and Executive VP of Achieva. In addition, Ms. Erin Grimes, one of Achieva's valued advocates, and DSPs, who will be speaking in just a moment, and Ms. Sierra Wechtenheiser and Ms. Christy Wechtenheiser, two young women Achieva has the privilege of supporting. Thank you all for being here. And before I introduce our first speaker, I just wanted to say a few brief words. Just a little about Achieva. We started in 1951 by a group of families who wanted more for their children than with intellectual disabilities than a life in a state institution. Today, we have over 600 employees, and we serve thousands of people with disabilities and their families in the greater Pittsburgh region. Achieva's vision is to assist people with disabilities to lead lives of personal significance. Not what's significant to others, but what's significant to them. We are a nonprofit charity, and we're largely dependent on public resources to cover the costs of services we provide. We utilize charitable donations and grants to fill holes and gaps in funding. This is why Governor Shapiro's budget proposal is so vitally important. It includes a significant investment into the intellectual disability and autism service system that we are a part of. $217 million in state funds, which will draw down an additional $266 million in federal funds. That's a total of $483 million in total investment in the current IDA system. And it couldn't come at a better time. We've only had one rate increase in 7 years. And so organizations like Achieva are running deficits as we speak. And we're having a very challenging time attracting and keeping direct support professionals because we can't pay them as much as they deserve. That's led to DSP turnover rates and vacancy rates that are unacceptably high. The governor's budget also invests another $78 million in total state and federal funds to reduce the waiting list, which is, it'll invest 1,500 more people from the waiting list statewide. There are 6,000 people on the emergency waiting list statewide, and 500 of them are in Allegheny County. So in short, speaking on behalf of Achieva, we are so very much appreciative of the governor's budget. Governor Shapiro has made people with IDA a budget priority, and we thank him for his leadership. Now we just need the General Assembly to pass the governor's proposed IDA budget intact. And with that, I think this is a good segue to hear from someone who's in the General Assembly. I'd like to introduce a great friend and supporter of Achieva's and to people with disabilities, State Senator Jay Costa.
Thank you very much, Steve, and thank you for allowing me the opportunity. And thank you to Achieva, everyone here, for opening certainly today's meeting to talk about this important issue and also the work that all of you do. It's extremely important, we know that, and I'd be remiss if I didn't mention my former co-worker with all of you, Nancy Murray, who was a big part of the conversations we've had over the years. Steve, thank you for talking about some of the things that we need to do. Steve talked about the governor's budget proposal, which is outstanding in my view. When you think about $217 million more, it's going to draw down another 260 some. That's a significant increase, and that's a significant number of folks we're going to be able to address. But what's important about that, it also goes to the workers who are going to be part of this conversation, recruitment and retention, and making certain that the wages that are being paid to folks, an increase in terms of what needs to be done there. So we have top quality professionals working with all the individuals who are participating in this program and across the Commonwealth. To me, that's what's important. Was indicated earlier, the governor has really elevated the priority of this discussion here in Pennsylvania by certainly the budget requests he made, but also last September when he made the request that we examine assessing the rates that are being paid and taking steps to address that, recognizing that the workforce shortage that we were dealing with, certainly in this space as well as many other spaces, how important it was to provide the resources to be able to do that. While it would be great to be able to provide more services, at the end of the day, if we don't have competent, professional, qualified professionals to provide those services, it's not going to be benefiting the people who we want to serve, who have the right to be able to live with great dignity along those lines. So I'm really honored to be here and really supporting the governor's proposal. I can tell you for myself and my caucus members, the other 21 members of our Senate Democratic Caucus, we stand shoulder to shoulder with the governor and our House colleagues to make sure that the governor's proposal is intact, as Steve talked about, to ensure that we not only do this piece that's on the banner here, but also the additional folks that we'll be able to address with the waiting list as well. So we have a challenge ahead of us. We have the resources to do it, which is most important. It's about how, as a collective General Assembly, we prioritize the need and the things that we want to do for the folks with disability and autism. So I'm really honored to be here. Thank you, Governor, for what you put forward. And now it's my honor to introduce your representative here on this part of the South Side, Representative Ariane Abney.
Good afternoon. Ariane Abney. I have the pleasure and the privilege of representing my neighbors in the 19th State House Legislative District, which includes where we are here today in South Pittsburgh. I want to welcome Governor Shapiro back to the district. I want to thank him for his commitment to the advancement of this Commonwealth, and particularly for his unbridled enthusiasm for the success of Pittsburgh and Allegheny County and Western PA. I had the pleasure last week of participating in my colleague, State Representative Dan Miller's, I think his 11th annual Disability Rights Summit. And in one of the presentations, the presenter, the first thing that she did was she showed a picture. And it was a photo of her and other disability rights advocates who were up in Harrisburg at the governor's office, meeting with the governor and meeting with his staff. And she attributed that meeting to being a kickoff point to helping us get to the point that where we are here today. So I want to thank Governor Shapiro for listening to stakeholders and advocates, for his willingness to be able to move beyond just having conversations to actual action, to being able to move beyond just being interested in this topic to saying, let's actually put investments behind this to provide some solutions. And so as a social worker myself, I have a real affinity for our direct support professionals and what they do. Like social workers, many of them provide more service than what they are paid for. And I understand that a lot of times when you are in this helping profession, you really feel as if the money is not necessarily always the motive when you know that your purpose is priceless. And that's what a lot of these DSPs are. They're priceless. But when stakeholders, they come and they advocate to the governor and to the legislator for better pay, they're not necessarily advocating for themselves and for their members to be rich or to be wealthy. What they're advocating for is for their value and to get the justice that they really deserve and to ensure that their pay is on par with the services that they provide. And so I'm a firm believer that how we compensate folks really speaks to our values. And it is a measurement and is a litmus test for how well, or maybe not so well, that we are doing as a society. And there is an analogy that I use often, I think is very fitting and apropos for this situation when we talk about the workforce shortage of DSPs. And that is that, you can spend your time and your energy and your life trying to chase butterflies, but eventually those butterflies will fly away. Or you can spend your time and your energy and your life creating a beautiful garden, creating a beautiful environment and a beautiful ecosystem that attracts butterflies so that you don't have to spend your time and your energy trying to chase them, they will come to you. And that's what we're talking about with paying people what they deserve, especially our DSPs. And so our direct support professionals are a key part of our workforce, and they help to contribute to the success of our economy in this Commonwealth. They should not have to choose between being in such a critical helping profession or being financially stable. This investment is really designed to address that false choice by creating a win for workers, for those they serve, and for the greater good of our society. And so I'm not 100% sure if Governor Shapiro in reality actually has a green thumb, but it was a good it was a good metaphor for him and what he's trying to do, and I appreciate him for his leadership on this effort. And so without any further ado, I will introduce our next speaker, who actually we get to hear from someone who is actually a direct support professional. So I want to welcome up to the podium, Ms. Erin.
Thanks, Aaron.
Thank you.
Thanks, guys.
Thank you all for your time. My name is Erin. As a direct support professional and advocate, I witnessed the critical need for home and community-based services and the care and supports provided. Unfortunately, the essential workforce is struggling due to inadequate compensation. DSPs provide vital supports and are not being paid a livable wage. The result of this shortfall is dire. Countless people and their families are left without the support they desperately need, as there aren't enough direct support professionals available to meet this demand. Calls inundate advocacy lines with pleas for help, highlighting the wide spectrum of needs from daily living skills, interpersonal relationships, living independently, to behavioral and mental health needs. An investment in service programs is imperative. Competitive pay and robust reimbursements for DSP services must be prioritized to attract and retain talented and invested caregivers. Such an investment is not only about meeting immediate needs, but also about fostering inclusivity, dignity, and the independence for all members of society. I have by far learned more from the people I support as a direct support professional than they have learned from me. Teamwork, trust, and respect are the foundations we carry with us. I strive to be a person-centered, lifelong support for those who would choose to have me in their lives. I would wish this for every person who needs home and community-based services. By adequately compensating DSPs, we can ensure that everyone has access to the care and support they need to survive in their homes and the communities. Let us come together to advocate for change, demanding the recognition and support that DSPs rightfully deserves. The time for action is now. Thank you.
Good job.
Thank you everyone for coming here. Hello, my name is Christy Wechtenheiser. At the age of 16 in 2008, I became a member of Achieva. I was a struggling individual who could not find the supports I needed. When it came to having a DSP who was not available to care for my needs, so I understand the struggles for other individuals, especially a friend of mine who is also a member of Achieva. In 2011, a DSP named Crystal, and in 2013, a DSP named Erin, who became my support systems when I couldn't get the supports I needed today. I have a job coach and caseworkers who are able to give me funding to support me as an individual with special needs so I can grow into the adult I need to be.
Good job. Good job.
Thank you all for being here. Hi, I am Sierra Wachtenheiser, and I am supported by Achieva. Erin started out as my friend before she became my direct support professional. Erin means a lot to me. DSPs are supportive, respectful, good listeners, kind, and very understanding. Erin and I took the time to get to know each other, and it was exciting to learn how much we have in common. I am a founding member of a healthy relationship peer group. I have advocated for my friends. One of my friends needed help with dating advice, as that was hard for her. Another friend doesn't have a direct support professional. I took them under my wing and invited them to activities and events that we wanted to do. We have a very strong trust with each other. I am here today to speak for people who are not able to be here and speak for themselves.
Thank you.
Thank you.
Good afternoon, everyone. I'm State Representative Jessica Benham, and I represent the 36th Legislative District, which we are just blocks from here. And it is wonderful to see so many good friends and former colleagues in the disability advocacy space. I'm a person with multiple disabilities, including being one of 2 openly autistic women to serve in our state legislature. And I'm also someone who previously worked in the IDA advocacy space. So it's wonderful to be back here at Achieva. I'm honored to stand here in support of Governor Shapiro's budget proposals around ensuring that individuals with intellectual or developmental disabilities can access the care that they need. We currently have a caregiver shortage, both in the IDA field and in other fields, because these folks don't get paid enough, sometimes as little as $12 an hour. I'm grateful that Governor Shapiro is prioritizing investments in HCBS providers so that they're better able to attract and retain workers. And I look forward to continuing to work with the Shapiro administration to ensure that care workers in all fields receive living wages and benefits. Because care work is valuable work, and those who rely on the care of others know this better than anyone. That's why it's so important that Governor Shapiro has listened to our community and has heard our needs. And I'm glad I get to be part of the legislature that works with him to get this done. And so with that, I'm honored to introduce the 48th governor of the Commonwealth of PA, Governor Josh Shapiro. Thank you for fighting for our community.
Thank you, Rep. Thank you so much, Rep. And it is so wonderful to be here at Achieva. You know, you can feel the love in this room, and you can feel the purpose in this room. And I want to begin by picking out one word that was used in both Representative Abney's beautiful comments. I would say it is not butterfly, though I thought that was a beautiful way to say. But Representative Abney and Representative Benham both used the word listen. And so I want to begin by talking about listening. Years ago, I had the opportunity to serve alongside Senator Costa and before Representative Benham, Representative Abney in the state legislature. And it was year after year after year where folks in the IDA community would show up in the Capitol. Sometimes they would roll up in the Capitol. And they would come and they would talk to us about the needs being greater and greater and greater in the community. And every year they came, every year they were heard, maybe not listened to, but heard. And then every year come budget time, there were always other priorities. Notwithstanding incredible work by Leader Costa, Senator Costa, over many years to try and elevate this issue, it never quite got across the finish line. I listened a lot, and then I was elected to lead Montgomery County's government as a county commissioner, where in many ways, as you know here in Allegheny County, a lot of the services for folks in the IDA community come through our counties. It's where the rubber meets the road, along, of course, with our school district in wonderful places like Achieva. I saw firsthand what it meant when you didn't have the resources in a community that was necessary to make sure that everyone could live with dignity and live to be their best selves and contribute in our society. Got elected governor thanks to so many in this room, and I had the opportunity to listen to Cindy and Matt. I want to tell you about Cindy and Matt because their stories, I think, reflect the stories of so many across Pennsylvania. Matt lives out of a wheelchair every day in the Lancaster area, kind of in the south central part of our state. His mom, Cindy, is about 60 years old. She's battled her own health issues. She had a bout with cancer, and thank God she's overcome that. She's the primary caregiver for Matt. Matt qualifies for all kinds of support, but isn't able to get it. He's not able to get it because they don't have the necessary direct support professionals or DSPs in the community where he is. Their story is one that I have listened to all across Pennsylvania. But that meeting with Cindy and Matt for me last fall, that was the end of listening. It was time to act. I left that meeting, went back into my office in the Capitol, and had to control the tears that were coming down my face. Tears because someone as wonderful as Matt wasn't able to live his fullest life. Someone as wonderful as Cindy was being pulled in a million different directions and not able to live her life maybe the way she had imagined it, dealing with her own health issues and dealing with so many challenges within her family. I summoned my team together and we said that was going to be the moment where we stopped just listening and we started acting. Year after year after year, budgets have come forth, numbers have been written on a sheet, and budgets have been passed. And great organizations like Achieva have been forced, as you heard a moment ago, to take out more debt. Families have been forced to cut back, and others have been unable to live their best lives. That ends right here, right now, in the Commonwealth of Pennsylvania. Because I refuse, and Representative Abney refuses, Representative Benham refuses, and Leader Costa refuses to look at a budget as just a series of numbers. A budget instead should be a statement of our principles and our priorities. It should reflect who we are as a society. That we're going to look out for the most vulnerable among us. The people who need the most help are going to be there to receive the most help. And so after years of a few $1,000,000 here or there being thrown in the direction of the IDA community, this year we are proposing an historic investment of more than $500 million to ensure that a continuum of care and education and opportunity is available for the IDA community across Pennsylvania. It starts in our schools, where we're proposing an additional $50 million for special ed on top of the extra $50 million that we passed together last year as part of our budget to make sure that those who are in a school environment get the support that they need. It means that the wait list that exists, over 1,000 here in Allegheny County alone, the wait list that exists all across Pennsylvania will be brought down in a meaningful way. Our budget proposes to fund eliminating more than 1,500 of our fellow Pennsylvanians off that wait list. And importantly, our budget proposes, because again, this isn't a series of numbers, this is a statement of priorities and principles. Our budget proposes to make sure we pay our DSPs, our direct support professionals like Aaron and so many others across Pennsylvania who do this work with a beautiful heart and a beautiful mind and capable hands, proposes to both pay them more and make sure we bring more DSPs into this service space. We began, after that meeting with Cindy and Matt, a process where we had to study the rates that we pay DSPs. It's a confusing process, but in effect, the state sets a rate and then has to fund that rate in order to set a standard of pay for these wonderful people like Aaron. We issued that study in the fall, and we came back in a position in this budget to say we are proposing to put over $200 million of state money, which will be matched by over $200 million of federal money, to create a product of nearly $500 million to both raise the rates that DSPs get paid, entry level and beyond, and to make sure that we're in a position to recruit more DSPs into this space. That is critically important if we want to make sure that we are helping the very people that Achieva works to support each and every day. People like Sierra and Christy, who you heard from a moment ago. It is time that Sierra and Christy have more Aarons in their lives. One Aaron is great. We just want a lot more Aarons out there. And this budget is an opportunity to do just that. There are 13,000 Pennsylvanians who are waiting for some or more services. We have an 18% vacancy rate in the number of DSPs that are available to provide support across Pennsylvania. I was at a facility like Achieva in southeastern Pennsylvania a few days ago. It's called BRAC, B-R-A-C. It's in Bucks County. They have a 48% vacancy rate there. And the effect of that is that folks who should be getting 5 days worth of care we're telling them they get 3 days worth of care or 2 days worth of care. The effect of that is that people have to work overtime because they love their clientele so much that they want to provide supports for them. And yet, we keep falling behind. I refuse to let Pennsylvania fall behind when it means caring for our IDA community. I've put forth a budget proposal that reflects our collective values, our shared values. And let me tell you something. This budget is fully paid for. We can invest in the IDA community and all the other things we want to do and still cut taxes and still, by the way, have an $11 billion surplus left over at the end of the day and make great progress in education and public safety and economic development and so many other things we also care about. This is a moment to invest again in Pennsylvania. And this is a moment to invest in our IDA community and the wonderful people that make it up and the wonderful people who provide great opportunity for us here in Pennsylvania. And now we have a responsibility to provide opportunity back for them. So I want to thank Achieva for having me here today. Steve, I want to thank you and your team here for doing incredible work day in and day out. And I'm mindful that you as the leader had the opportunity to speak up here at the podium, but I know you'll agree with me, the staff that you have working with you as your colleagues do remarkable work here, and we salute you, we salute all of them, and I thank you all very much for being here today. I'm looking forward to the opportunity to get to know some of you. Before I do that, I have to answer some questions from the media. So we're going to do that first, and then we'll get a chance to visit. And I'll invite any questions from the media for me or any of the other speakers who are here today. Yes.
I wanted you to talk more about this community waiver program. Does that benefit like families, or does it benefit services and programs? How does that work?
It expands services for families and individuals who need that support, need that care. Once fully funded, we'll be able to provide far more supports than we're able to right now.
Off-topic question. I know you've been very vocal.
Let me come
about
back to
the
off-topic if you don't mind. Anything else on this? No? All right, I guess we got to go off-topic.
I just have to.
No, I'm always happy to answer your questions. I just want to make sure we cover this. Go ahead.
You've been very vocal. Today is the start of the draft, so we're talking about trying to push to bring it to Pittsburgh.
Oh, yeah.
Anything to say about that?
There is, let me tell you, there is no better place in the world to host the NFL draft than right here in Pittsburgh. I've been working closely with Art Rooney and the Steelers organization. They are a top-notch, amazing organization. They, together with the city and with Visit Pittsburgh and all the other organizations involved, put forth a great proposal. And I've been twisting the arm of Commissioner Goodell in the NFL. I won't get into our private conversations, but suffice to say, I've been pretty aggressive in making the case for Pittsburgh. There's an owners meeting in May. We're going to continue to push as hard as we can until then, and hopefully we'll have some good news to report then. But we're going to keep doing everything we can to put our best foot forward here in Pittsburgh. This would be a remarkable place to host a draft, and I'm willing to go on a limb and say I believe it'll be the most successful NFL draft to date if we can host it here in Pittsburgh.
The protests that are going on in colleges across the country,
Yeah.
especially there's one that happened locally here in Pitt. Any comments to say about that?
I'm mindful that on college campuses and communities across this great country, we have to give people the opportunity to organize and rally and peacefully protest in accordance with whatever the rules are of a university, a city, a county, or a state. I think that there are people out righteously protesting and peacefully protesting. And I think it's important that their voices be heard in the halls of power and by those who are making decisions on the issues that impact them most. I think it crosses a line when you begin to create a lack of order on campuses or in communities, where rules begin to be violated, laws violated. And that is, of course, what we are seeing on the grounds of Columbia University. Now, importantly, juxtapose that with the University of Pittsburgh. I could not be more impressed by the leadership of people like Joan Gable, the chancellor, Kevin Washoe, one of their executive vice presidents, and others, who have ensured that students at Pitt feel as though they can be heard, that they can protest peacefully, but that Operations at the university will not suffer, will not be derailed, and order will be maintained on campus. Students will be able to make their way to class, take their finals. Graduation will go forward as the festive time that it should be for all involved. Yet there is still arrangements being made in coordination with Mayor Gainey and the city of Pittsburgh to allow those who want to make sure their voices can be heard peacefully to have them be heard peacefully. I think Pitt is an example of how to find that balance, a difficult balance, but how to find that balance. Juxtapose that with what's happening at Columbia, where they are out of balance and out of order. And the university leadership there has clearly failed in maintaining order on campus. And so I want to compliment again Joan Gable and her team at Pitt. I think they're doing a really good job under really difficult circumstances. Yes.
Governor, we had the news from UPMC yesterday that they made about 1% of layoffs.
Yeah.
They're hardly the only hospital system in the state that are under pressure.
Mm-hmm.
What can the state do to sort of help both the small rural hospitals, the larger hospitals, and the systems to get through this kind of difficult time, if anything?
I think there's a couple different issues there, Paul. First off, the roughly 1,000 folks who were laid off at the direction of UPMC leadership are not on the healthcare delivery side. They're on the office or administration side. And UPMC has communicated to our office about their decision and their rationale for that decision. Separate from that, there is a crisis in rural Pennsylvania, rural America, when it comes to continuing to provide accessible, high-quality health care in all communities. We're seeing that play out here in Pennsylvania. It's the reason why months ago we put forth a working group made up of lawmakers and healthcare leaders, leaders in local rural communities, to make sure that we could maintain a level of care, that we could change with the times, rely more on technology, rely more on access points throughout Pennsylvania so that you could get certain care right in your neighborhood and maybe a different type of care in other areas. I expect that we're going to be able to put forth a really comprehensive plan to address rural health care in the coming months. I spoke about that in my budget address, made a commitment to do that. I view this as one of the, if not the most significant healthcare challenge that we face in Pennsylvania today, and it's something that we have to continue to address, working together with major healthcare institutions like UPMC, AHN, and others, together with our public stakeholders. I'm confident that we're going to find a way forward on this. Thanks. Anybody else? Thank you very, very much. Appreciate it. And thank you to Achieva for hosting us today. Thank you.
Thank you.
Have a wheelchair every day in the Lancaster area, kind of in the south central part of our state. His mom, Cindy, is about 60 years old. She's battled her own health issues. She had a bout with cancer, and thank God she's overcome that. It is one that I have listened to all across Pennsylvania. But that meeting with Cindy and Matt for me last fall, that was the end of listening. It was time to act. I left that meeting, went back into my office. Wonderful as Cindy was being pulled in a million different directions, not able to live her life maybe the way she had imagined it. I like that. That is sharp. So you're hanging out with Dad? That's awesome. Yeah, man. It's really great to meet you. That's awesome.